Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
Chapter 55, we have assessment of gastrointestinal function. Here it shows how NCLEX is distributed in a pie and percentage. And I'm going to make 16 questions for this chapter practice exam and with rationale. And I hope the NCLEX will bring you success. This is my secret, that the psychology behind those domains of NCLEX will give you an insight how to answer those questions, because NCLEX is broken into 15 specific areas. And we have management of care, basic care, and by practicing questions and see the domains, we take one chapter at a time and see what is related to that particular area of a chapter. And then when hopefully when candidate is at the NCLEX will recognize which area is and how to understand those questions. And think that pharmacological and management of care, it's a huge pie, and also psychosocial adaptation as well. And some questions they have like two from this pie, or action, take action, evaluate the outcome. So basically I'm going to show at the end a few questions, like select all of the apply that have to those NCLEX specific area. So for assessment of gastrointestinal function, I did a outline, so please check that out. And here it's more like the percentage. Imagine that you want to aim for 100 questions in the NCLEX. Imagine how many questions or select all the apply case study you have to answer to complete this. So now we're moving to the next. Here we have like about history. When you take a history, recognizes cues, focus physical assessment, recognizing cues, lab diagnostics, general solution. So these are examples, these are definition, and a concrete example from our chapter 55. If you see here, right upper quadrant, pain plus jaundice and elevated bilirubin, possible obstructive jaundice from gallstone stone in common bile duct. I'll go to the next. Here it's a key concept from our chapter 55, NCLEX client needs category. Here it's the basic care and comfort. I have two examples, but later in the quiz, I have more example for basic care and comfort. So position patient with reflux um, in a semi-follows position to reduce symptoms. Provide oral care for patients with decreased saliva production or dysphagia. And pharmacological, also I have a lot of example in the quiz. So basically I have a lot of example in the questions based of this table NCLEX client needs category. So now we go with a small little case study and the 16 questions that I made for this video. I have laryngitis and my throat hurts. Case study. An older adult is admitted to the medical surgical unit with complaints of abdominal pain, distension, and decreased appetite for the past 3 days. The patient reports nausea and vomiting of dark-colored material over the past 24 hours. Vital signs: blood pressure 100/64, heart rate 112 beats per minute, respiratory rate 22 per minute, temperature 38.2 Celsius, 100.8 Fahrenheit. Oxygen saturation 94% on room air. Bowel sounds are hypoactive in the quadrant. In all quadrants. Laboratory results shows the hemoglobin 9.5 and hematocrit 29%, white blood cells 14,200, and elevated serum bilirubin. An abdominal CT reveals ascites and possible perforation of the small intestine. The provider has ordered NPO status, IV fluids, and NG tube insertion, and broad spectrum antibiotics. Question 1. Initial priorities, domain, management of care. Which initial nursing intervention is the highest priority? Administer ordered IV antibiotic, insert the NG tube as prescribed, administer analgesics for pain control, initiate and maintain NPO status. Initiate and maintain NPO status is the correct answer because preventing further GI contamination from oral intake is critical with suspected perforation. While antibiotic and NG tube insertion are important, NPO status is a first step to prevent worsening. Question 2. Domain safety and infection control. Based on a data, which complication is the patient most at risk for developing? Peritonitis, hepatitis A, cholelithiasis, pancreatitis. Peritonitis, because signs such as abdominal pain, distension, fever, and elevated white blood cells count with imaging showing possible perforation indicate high risk for peritonitis due to GI content leakage. Question 3. Psychosocial adaptation. Which lab finding is most concerning and requires immediate communication with the provider? Hemoglobin 9.5, white blood cell 14,200, serum bilirubin elevated, hematocrit 29%. Correct answer is hemoglobin 9.5. grams per deciliter because low hemoglobin indicates possible GI bleeding and compromised oxygen delivery requiring urgent intervention. Question 4. Main is pharmacological and parenteral therapies. The nurse anticipates administration of which antibiotic for suspected peritonitis? Vancomycin, piperacillin, tazobactam, azithromycin, ciprofloxacin. Correct answer is piperacillin, tazobactam. Because it's a broad spectrum antibiotic like piperacillin, tazobactam cover gram-negative and anaerobic organisms common in GI perforation. Question 5. Health promotion and maintenance. Which teaching point is most important for this patient upon discharge after recovery? Increase high-fat meals for caloric needs. Avoid heavy lifting until cleared by provider. Begin strenuous exercise immediately, discontinuing all medication unless symptomatic. Avoid heavy lifting until cleared by provider is correct answer because avoiding heavy lifting prevents increased abdominal pressure, reducing risk for reoccurrence or herniation. Question 6. NCLEX domain management of care. Which task is appropriate to delegate to an experienced, unlicensed assistive personnel? Assessing for abdominal rigidity, teaching the patient about NPO status, recording intake and output, adjust the NG tube suction settings. So the assisted personnel, the unlicensed, will record intake and output. That's the correct answer. The assessment, teaching, and adjusting medical device are the nurse responsibility. Question 7. NCLEX domain, health promotion and maintenance. During an abdominal assessment, which sequence should the nurse follow? I said a few times on previous video on the outline. A. Inspection, percussion, palpation, auscultation. Inspection, auscultation, percussion, palpation. Auscultation, inspection, percussion, palpation. Percussion, palpation, auscultation, inspection. Correct answer is inspection, then auscultation. Percussion, palpation, it's at the end. It's in a book saying that the correct sequence is inspection, auscultation, percussion, palpation to avoid altering valve sounds. Question 8. NCLEX domain, basic care and comfort. Which vitamin deficiency is most likely with chronic bile duct obstruction? Vitamin A, vitamin C, vitamin B12, vitamin B6. It's a vitamin A. Bile is needed for the absorption of fat-soluble vitamins A, D, E, and K. Obstruction can cause deficiencies. Question 9. NCLEX domain, reduction of risk potential. Before a scheduled colonoscopy, the nurse should verify which priority pre-procedure requirement. The patient has been NPO for 8 to 12 hours. The patient has taken a laxative and bowel prep solution. The patient has signed an informed consent. The correct D, all the above. Correct answer is all the above. Colonoscopy require informed consent, of course, bowel cleansing, and NPO status before the procedure. Question 10. So we have 6 more to go. NCLEX domain, safety and infection control. Which PPE is required when providing care for a patient with suspected hepatitis A? Gloves only, gloves and gowns. Gloves, gown, and mask. No special precaution. Is gloves and gowns. Hepatitis A spread via fecal oral route. Contact precaution, gloves and gown are necessary. This is very important and might be in the NCLEX for everybody. Question 11 for diagnostic testing and pharmacological. A nurse is reviewing the medication administration record for a patient, for a client, who is scheduled for a flexible sigmoidoscopy the next morning. Which of the following medications should the nurse verify have been temporarily discontinued before the procedure? Select all the apply. Warfarin, metoprolol, clopidogrel, aspirin, famotidine. Warfarin, clopidogrel, aspirin. Because here is the rationale. The text explicitly states that the sigmoidoscopy medications such as aspirin, clopidogrel, antiplatelet, and warfarin anticoagulant may need to be stopped temporarily due to the risk of bleeding during the visualization or potential biopsy. B and E are incorrect. So metoprolol is a beta blocker used for hypertension or heart rate control. There is no indication in the textbook about this. Famotidine, it's an H2 blocker used to reduce stomach acid. Question 12. Risk reduction. Reduction of risk potential with taking action and evaluate the outcome. For barium enema. A nurse is caring for a client who has returned to the unit following a lower GI barium enema. Which of the following actions should the nurse include in the patient plan of care to prevent complication and evaluate the outcome? Select all the apply. Maintain NPO status until the gag reflex returns. Encourage the client to increase fluid intake. Monitor the client's stool for white chalky appearance. Administer a mild laxative as prescribed. Monitor the client for constipation or bowel obstruction. So correct answer are: encourage the client to increase fluid intake, monitor the client's stool for white glitchy appearance, and administer a mild laxative as prescribed, and monitor the client for constipation and or bowel obstruction. So the rationale, it's a little bit written small, but I hope you can see. So encourage the client to increase fluid intake, monitor the client's stool for white glitchy appearance, and administer a mild laxative as prescribed. Monitor the client for constipation or bowel obstruction. So for the post-procedure care for barium status requires increasing fluids and administering laxative to aid expelling the barium. Barium can harden in the intestine, leading to constipation or impraction obstruction. I said that in outline. The nurse evaluates the passage of barium by monitoring the stool. It is normal finding for stool to appear white or chalky for 24 to 72 hours post-procedure. So A, it's incorrect MPO status to check for the gag reflex is required for an upper GI status. Question 13, clinical judgment and prioritizing hypothesis. A nurse is performing an abdominal assessment on a client. Which of the following cues should the nurse prioritize as potential indicators of an acute pathological condition requiring immediate attention? Select all the apply. A shooing sound auscultated over the abdominal aorta. Tympani noted upon percussion on the intestinal quadrant. A rigid board-like abdomen was noted during light palpation. Blue-purple discoloration observed around the umbilicus. Pulsation visible between the xiphoid process and the umbilicus in a very thin client. Correct answer is a shooing sound auscultated over the abdominal aorta. A rigid broad-like abdomen was noted during the light palpation. Blue-purple discoloration observed around the umbilicus because showing sound indicate a bruit, which it's never a normal variant and may signal an arterial obstruction or abdominal aortic aneurysm. The nurse should avoid palpation and report this immediately. If you can see here, a rigid board-like abdomen, it's abnormal finding that typically indicates peritonitis, inflammation of the peritoneal cavity, pain, or grinding. D also it's correct because the blue or purple coloring around the umbilicus is known as Cullen sign, which is associated with intra-abdominal bleeding. Question 14. We have two domains here. It's about medication management, sigmoidoscopy, pharmacological and parenteral therapies, and take action, NCLEX domain. A nurse is reviewing the medication administration record for a client who is scheduled for a flexible sigmoidoscopy the next morning. Which of the following actions should the nurse take regarding the client's scheduled medication? Select all the apply. Withhold the scheduled dose of warfarin, administer the scheduled dose of metoprolol, withhold the scheduled dose of clopidogrel, withhold the scheduled daily aspirin, withhold the scheduled dose of fatodimine. So earlier I said which meds should be held, and some they can be given, but here it's very tricky, the wording here. So this might be very tricky. Correct answer are withhold the scheduled dose of warfarin, administer the scheduled dose of metoprolol, because it's like you can give, withhold the scheduled dose of clopidogrel, and withhold the scheduled daily aspirin. So these are the rational. You see here pharmacological and take action. So the nurse must take action to withhold medication that affect the coagulation, such as warfarin, anticoagulant, clopidogrel, antiplatelet, and aspirin for prior the sigmoidoscopy. Those are temporarily discontinued to reduce the risk of bleeding during the procedure or potential biopsy. B is correct because the nurse should take action to administer the metoprolol, and also needs to take also administer. If here was administered, then also was correct, but it says withhold. No, that's incorrect. Question 15. For barium enema, we have reduction risk potential, evaluate outcome. So the nurse is caring for a client who has returned to the unit following a lower GI barium enema. Which of the following findings should indicate the client is progressing as expected? Which intervention should reduce the risk of complications? Select all the apply. The nurse passes a stool that is white and chalky in appearance. The nurse encourages the client to increase fluid intake to 2 to 3 liters unless contraindicated. The clients report feeling constipated and has not passed gas for 6 hours. The nurse administers a prescribed mild laxative. The nurse maintains the clients on NPO status until the gag reflex returns. Correct answer are: the client passes a stool that is white and chalky in appearance. The nurse encourages the client to increase fluid intake to 2 to 3 liters unless it's contraindicated. The nurse administers a prescribed mild laxative. So the rationale is that the nurse evaluates the outcome of the procedure by inspecting the stool. It is normal, expected finding for stool to appear white or clatchy for 24 to 72 hours as the barium is excreted. The B and D also are correct. You see two different NCLEX domain here, because the barium can harden in the intestine, creating like a cement-like mass. The nurse reduces the risk potential for impaction or obstruction by increasing fluid and administering laxative to aid in elimination. So here you see why it's the incorrect. The last question, question 16, for pathology, abdominal assessment. So we have psychosocial adaptation and recognized cues. So a nurse is performing an abdominal assessment on a client admitted with abdominal pain. Which of the following assessment findings should the nurse recognize as a red flag cues indicating a potential acute physiological deterioration? Select the apply. Auscultation of swashing sound over the abdominal aorta. B. Percussion of tympani over the left lower quadrant. Palpation of a rigid board-like abdomen. Observation of blue-purple discoloration around the umbilicus. E. Observation of a midline pulsation between the xiphoid and umbilicus in the thin client. The correct answer is auscultation of swishing sound over the abdominal aorta, palpation of a rigid board-like abdomen, observation of a blue-purple discoloration around the umbilicus. So they are correct because a swishing sound is a bruit. The nurse must recognize this cue as a sign of arterial obstruction or abdominal aortic aneurysm. So this is a critical physiological deviation that requires the nurse to stop palpation immediately. The palpation of a rigid board-like abdomen. Rigid board-like abdomen is a classic sign of peritonitis, inflammation of peritoneum. The nurse recognizes this as an acute psychological adaptation to infection of perforation. So if you see this, it's a little bit similar like previous. Blue-purple coloring around the umbilicus is the colon sign, which the nurse should recognize as a cue for intra-abdominal bleeding. So that's the questions for this assessment of gastrointestinal function chapter in the GI unit. Thank you for watching and see you in the next chapter. Bye for now.
We finally made it! Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.